Yes, absolutely. It was actually a report. It was a clinical and governance review of the existing hospital structure that was conducted by Howard Associates. They were brought on board in November of last year, prior to the election, and they completed their work at the end of March and presented the board, the new board, which I have actually appointed, with a copy of their report, which was done in the beginning of April of this year. That report highlighted some deficiencies that existed, but we were absolutely precluded from delving into some of the areas, more specifically relating to the public concern about what happened with the former chief of staff, who was Dr. Donald Thomas. What was interesting in that respect was there was a separation agreement between the hospital's board that was overseen by the former administration, which had clauses that were absolutely airtight, which precludes us from disclosing the terms and conditions of that separation agreement. And so I was able to speak to that in the House of Assembly and to explain the limitations that we have faced in not being able to give the public what they perhaps expected to hear. We have to respect contracts, which is one of the reasons why I was unable to do anything straight off the bat with any of the contracts that I found within the health ministry for consultants. I respect contracts. I respect the conditions of contracts, and I had to make those decisions. We have heard questions recently in terms of the status of the new build at the hospital. Let me just say that the structure of the hospital is that Paget Health Group are responsible for that construction, that if there are any things that will go wrong, as it were, if something is not completed, if something has to be changed, that will come under the responsibility of Paget Health, not the health ministry through the consolidated fund. So I think that's important for people to understand, that even though I've heard about, there are delays and somebody changed a wall and that kind of thing, that really is not a matter for the minister. It is really for Paget Health Group in conjunction with the hospital's board to ensure that they are getting the product that they want. The handing over of the hospital is meant to happen as of April of next year, with a payment of $40 million. The $40 million balloon payment is being raised by the Bermuda Hospital Charitable Trust, and hopefully my last count, the last report that I had, is that they had actually raised somewhere on the order of 27 or 28 million towards that 40 million. Subsequent to that balloon payment, there is an annual payment that is required for maintenance of the building, for management of the building, I should say, of the new build, for 26 or $27 million per year. I think it's 27 million per year for a 30-year period of time. These are contracts that have actually already gone into existence. They were signed, sealed, and delivered. The hospital was actually being built at the time that we took over the ministry, and therefore that is, again, a contract that we have to honor. I've actually been into the hospital a couple of times, and I've seen the progress that has been made from the first visit that I had 5 months ago to as recently as week before the last, when I had the last visit on the site that I've actually had. I've seen tremendous progress that has been made. Whether the building itself will fulfill its entire purpose remains to be seen. That is a 90-bed acute care hospital. We will always have the management of the new build as well as the challenges respecting keeping the maintenance going on the existing building. Whether one, in retrospect and hindsight, would have made different decisions, I won't speak to that, but let me just say that it's going to be a mammoth task for the hospital's board to manage the costs relating to the two different buildings, 90 acute care beds. We have the continuing care unit in the existing structure. We have the ICU, which is not going to change, but within the new building, we're having a lot of the new technology coming in. The MRI machines are going to be going there. Oncology is going to be there. There are many things that are going into the new build. All of those things that are relevant to acute care beds will be in the new build, and the board of directors will manage the estate planning to determine how best to use the existing structure.